Arthroscopy is like a keyhole operation. So it's commonly done in sports injuries, any ligament injuries in either shoulder or knee. These are common areas where routine arthroscopy was done. Arthroscopy can be performed in elbow and wrist also in very rare occasions. But common injuries where the arthroscopy in the shoulder happens for every ligament injury, even in frozen shoulder or rotator cuff tear or any labrum tear where the dislocation happens. For example, in the knee, ACL reconstruction or meniscus tears or any cartilage damage, the routine knee arthroscopy was done. Most of the people think it's an operation. Yes, it's an operation. It has to be done under anesthesia in operation theatre. But most of the times it gives the diagnosis to us. Means depending on MRI, where we can depend on the diagnosis 70% what's happening inside. But arthroscopy, peeping inside the joint, seeing with a naked eye, we'll know what is the problem, where the problem exists. At the same point, we can correct it also. So it's not a major surgery, it's a safe surgery, and there's no scar with that, it's only a keyhole operation. Arthroscopy for any ligament injury, what we said, it's a shoulder. The people will present in the young people, most common with the dislocation. Means Bankart tear or labrum tear is a common terminology where we use it. And middle age, 20 to 40 years, where the injuries happen because of fall or something, or overhead injuries, there's twisted hand while traveling, or hand caught, or sometimes the dog pulled out with his belt or something. These type of common injuries will be there, where it results in rotator cuff tears, means the muscle inside the shoulder will got torn. In the old age, generally we'll see for degenerative tears, or in arthritis also, on rare occasions, we can do the shoulder arthroscope. Coming to the knee, the most commonly injured joint in the body, the young people, because of sports injuries or misplaced type or road traffic accident where they can't balance the bike, the common injury is the ACL tear, anterior cruciate ligament. It can be repaired through keyhole operation or associated any meniscus tears also. Either two meniscus will be there. These are common things. People will present with locked knee pains, locking. Rather than a pain, it's a locking sensation, or sometimes patients give away feeling, means about to fall sensation while walking on uneven surface, not an irregular surface. So most of the people will neglect it because of this not a daily pain. So arthroscopy is helpful for sports injuries where rehabilitation can happen quickly, they can get back to the normalcy. So arthroscopic surgery performed through keeping a camera into the joint. It's a small pen-like size cameras will be there. We'll penetrate into the joint in different angles. At the same time, another hole made to work out on it. It's like a portal, we commonly call as a portals. One is camera portal, other is an instrument where we need to work it. So there are 2 to 3 holes, for any arthroscopic surgery. It's a whole operation performed by seeing the picture on a big screen. So it's a magnified image that presents to us. So it is more of, we can see what is the issue in the joints, what is the problem, where it is located, and we can rectify at the same point. Arthroscopy is less painful because there is no big scars, no big cutting is involved, and the recovery will be much more faster. Knee. Arthroscopy is like any surgery, but any surgery is going for an operation means we need to check carefully. He has to go for under anesthesia unless they have any big other health issues. It's not a big surgery, but if you have any existing illness, because any surgery can create some complications, so we need to check for it. But as such, arthroscopy is not a harmful surgery. It depends on problem to problem. Depends upon how it's a ligament tear, where it is torn, how many ligaments are there. So it depends upon the age of the patient, their functional capacity, and their muscle power, and their activity load also. People with sports background will recover much faster when compared to the normal population. After arthroscopy, lot has to go with the physiotherapy. If they do physiotherapy well and good, their muscle contour or muscle strength is good, means they can get back to normal. If they delay the physiotherapy, if they are not doing well, any surgery will be in bad position. This depends. For ACL reconstruction, generally we will say toe touch weight bearing, don't walk immediately. So that takes time. After 3 weeks, we'll give a full weight bearing. depends upon what type of ligament we take in. If it is athletic, we will have a different protocol. For a normal person, we will have a different protocol. So it all depends upon rehabilitation. We'll say accelerated rehabilitation. Some people require faster recovery because their sports training is pending. Some people doesn't do much exercises, they have a delayed recovery. So as such, exercises are more important after the surgery. Arthroscopy is like a type of investigation, but to be done under anesthesia. When every MRI is like inconclusive, arthroscopy will be better. Some people will say, I have a problem, but I am scared of MRI. MRI gives some preliminary diagnosis to investigate what's happening so that the plan will be there to be cured under arthroscopy, under surgery. If the problem is evident, existing, your surgeon might say, directly go for, if you are scared of MRI getting anything doubtful, arthroscopy will help directly to know what's happening inside, what's wrong with you, to confirm the diagnosis, and the same point can be rectified also. As such, there is no harm with arthroscopy. So arthroscopy is like a risk-free surgery. It's like a more of diagnostic value. At the same point, it is a therapeutic, means we can rectify the problems without anything. Arthroscopy will help any patient to recover much faster and most commonly performed in the sports injuries and in the safest.